Hi everyone, this is an anatomy and physiology video for healthcare students. In this video, we'll be covering body planes and sections. So body planes and sections are simply sections of the body, often done during, say, imaging, for instance. So when we're talking about a section or a plane, these may be allowing us to see body parts or organs that we might not be able to see from the surface. Sometimes these body parts are going to be divided among a plane that creates equal sections, maybe unequal sections. The only case that really matters for that is for a sagittal section. So let's walk through the three types of planes and sections. A transverse cross or horizontal section divides the body into a top and bottom piece, otherwise known as superior and inferior sections. Coronal or frontal sections divide the face side of the body from the rest on the back side. So this would be anterior and posterior sections. And then finally, sagittal means that we're dividing the body into left and right portions. If it is an equal left and right division that goes right down the midline of the body, that's going to be mid-sagittal. However, if it's an unequal division of left and right, it's going to be parasagittal. So like I mentioned, the only time having an equal section really makes a difference is for that last one, these sagittal sections. Let's take a look at some pictures. First one here, transverse, cross, or horizontal. We're looking down into the brain from a superior viewpoint. This allows us to create a transverse section that gives a superior and inferior view. So this scan may be just of the brain. It may travel further down in the body, but it's going to create sections or images that are from a superior or an inferior viewpoint. You're now looking at a coronal or a frontal plane. Notice how you're looking directly at the front of the body. You might be looking at the back side of the body. Either way, you're looking at an anterior or a posterior view. That's what a coronal or frontal plane or section will create. And then finally, sagittal sections create a left or right viewpoint. If it's mid-sagittal, it's equal. If it's parasagittal, it's unequal left and right sections. This particular picture might in fact be a mid-sagittal section because it looks like we're looking at half of the human body. Perhaps this is drawn right down the midline, dividing the body into equal left and right portions. Let's take a moment to look at these three pictures. The blue line for each picture is an imaginary line that we might use to create a plane or section. So starting from the left, we are looking at a line that's dividing the body into an anterior or front and a posterior or back. What kind of section must this be? That's a frontal or coronal section. So anterior and posterior planes or sections are created. In the middle picture, you'll notice that we're looking at a line right down the middle. It looks to divide the body into left and right portions. They may be equal, they may be unequal, but the key here is we're dividing it into left and right. This is a sagittal section. In fact, you could say it's mid-sagittal since it appears to be dividing the body roughly into equal halves. For the last picture, you'll notice that we're dividing the body into a superior and an inferior portion. This plane or section goes by three names: transverse, cross, or horizontal. Now, let's take a few moments to go through some sample pictures. I'm going to pause and let you identify before we reveal the answer. In this picture, you're looking at a left or a right viewpoint. That's what clues me in to know that this is a sagittal section. It's a side view, it's a left or a right viewpoint. That's what I need to look for. Sometimes these can be challenging because you're having to look at an X-ray, body plane scan, and figure out what you're looking at. So I'm seeing some vertebrae. I see a collarbone, a few ribs down here near the bottom, and I can see the skull, kind of the development of the face. And it looks like I'm looking directly at someone's face, maybe from the front, maybe from the back. That really doesn't matter. What I want to appreciate about this picture is I'm having a front or a back view. In other words, an anterior or posterior view. That tells me this must be a frontal or a coronal section, plane, or scan. So anterior, posterior views give us a frontal or a coronal, plane, or section. So again, what you need to do is recognize what you're looking at. You can see the brain. There are two eyes here, and it looks like we're looking perhaps down into the brain from a superior viewpoint. That's the clue you're looking for. This could be a superior or an inferior view. That tells me this must be a transverse, cross, or horizontal section. These always create superior and inferior or top and bottom views. All right, in this one, you're looking at perhaps a left or a right viewpoint. That's what I need to know. It's a side view. It's creating a left or a right view. That must be sagittal. If this is in fact along the midline, what type of sagittal section is it? It's mid-sagittal. So in this image, you're looking at a chest X-ray, and so you can see the heart here in the middle, and you can see the ribs on either side. So in this image, we are looking at a front or a back viewpoint. That front, back, or anterior, posterior viewpoint is what I need to know to confirm this one is a frontal or a coronal section. Well, I hope you're getting the hang of these by now. Once again, you're looking perhaps inferiorly down into the brain from a superior viewpoint. So if you can think of it that way, you're looking at top versus bottom. Those are the kinds of keywords you want to keep in mind because that will help you pick this one out as a transverse, cross, or horizontal plane. You may not recognize a whole lot about this one, except this vertebrae. That might be something you recognize sitting right there. And this is a section through an abdomen. So in looking at this picture, you might realize that you're getting a top or a bottom view of the abdomen. In other words, a superior inferior viewpoint. When I'm using the words superior and inferior, that tells me it's a transverse, cross, or horizontal plane or section. All right, and this one, you'll see the spine over here on the right-hand side, the sternum with the yellow arrow pointed at it. In this picture, we are looking at a left or a right viewpoint. We're looking at someone from the side. And again, use that as a clue. If I'm looking at a left or a right or a side viewpoint, what type of plane or section must this one be? Sagittal, right. So if it is not directly in the middle, if it's unequal left and right portions, this one would be classified as a parasagittal section. Okay, again, are you looking top, bottom? Are you looking left to right? Or are you looking front to back? Those are the questions you want to ask yourself to determine what kind of plane this is. Obviously, this is a foot. You're looking at it from a side view. A side view is always going to be what type of plane? Sagittal, right? So this is a sagittal section. It always gives us a left and a right viewpoint. Well, I hope you enjoyed this video. If you have any questions, please let me know. If you would like to see other material in the videos, please leave that in the comments section. And if you like this video, please follow my channel. Thanks for watching.